Hello, my name is Dr. Bryan Warner. I have a Body Logic MD practice in St. Louis, Missouri. Our focus mainly is on anti-aging, as relates especially to hormone therapy, but a lot of nutrition and prevention is involved, exercise, diet, everything that relates to preventing problems and making you healthy. I was traditionally trained in family practice and did my medical school in Chicago, Illinois, at Loyola University, Stritch School of Medicine. I went on to do my family practice residency training in Milwaukee at a place called St. Luke's Medical Center. And ended up after that joining the Air Force. I had gone in on a scholarship but spent 7 years with the Air Force. And so practiced traditional family practice as well as emergency medicine in the Air Force setting. And eventually when that time was over with, I just transitioned into regular family medicine. I did that for several more years until it started to burn me out. So I wanted something where I could control my schedule a little bit more, transitioned into ER since I had done that in the Air Force. And I did that for several more years, but after a while I knew all along that there was just a lot of things missing with regular medicine. So after I started looking into A4M and my very first conference I went to, I was hooked because I had finally met up with a group of doctors, MDs, DOs, who had practiced medicine also for several years and were tired of the same kind of thing that I was tired of. So it was good to get in a support group where I felt like we all think alike and we're looking for something more. We should look into the depth of what's causing the problem and try to get to that root cause rather than just rely on a quick fix prescription. The largest portion of patients for me are in their 40s or 50s. Usually by the time they see me, they're having some symptoms that need to be addressed, and a lot of times there is a hormonal cause for that. What I tell my patients is it's not just about reproduction. It helps every tissue in your body function much better and you feel much better. It's getting well documented now that coronary artery disease almost reverses and improves, and then in some emergency room settings when patients come in for early heart attack or a myocardial infarction, they're actually given testosterone right then and there. So it helps with bone preservation and even adding some bone back when you've lost some bone. It helps your brain, it helps you remember, it helps your skin, it just goes on and on.
I had major anxiety issues and my memory was bad. I couldn't finish a sentence, and I just started to have anxiety attacks, and so I would go to the hospital a lot because I thought I was having a heart attack. So that was one of my biggest problems. And then along with that, I had all the other symptoms. The night sweats, the feelings of bloatiness, the sadness, the depression, the no energy. I mean, there was all sorts of problems. We did a lot of one-on-one talking, discussing. We did the lab work. There was a lot of things missing in my physiological state. And that second visit, we discussed what I would be taking and tried it out. And then doctor met with me again. We played a little bit with my supplements and my hormones. I'm really feeling like we're making headway here, and I'm starting to feel actually pretty normal. And it's a nice change.
Stress management is huge. In fact, that condition called adrenal fatigue, which mainstream medicine has yet to recognize in most practitioners' office, I can assure you it exists. And when you address that and deal with the stress part of people's health, a lot of other things start to fall into place. That's a big part of what I do is I look at their cortisol levels through saliva as well as their symptoms. They're very telling, and when I help them with that stress management, which we have a very good comprehensive protocol to do that with, a lot of it is just getting sleep, getting people back to sleep who are having sleep difficulties in their 40s, 50s, or whatever age. Restoring sleep is a huge part of it, getting the nutrition back that they need. Exercise has to be a part of it. You can't not exercise. It just has to be a part of life or you're not going to make any progress with your health. So yes, we definitely give all those suggestions to people and kind of give them a roadmap of what to do. If you're interested in our practice, all you have to do is go to bodylogicmd.com on the internet and look for physicians and look under St. Louis and you'll find me.